The health minister has started his briefing around how South Africa is going to plug the gap left by the US cutting aid to the country insofar as the fight against HIV and AIDS is concerned. Aaron Motsoaledi at the podium. Let's listen in.
The HIV program has collapsed or is on the verge of collapsing or is inevitably collapsing. That is the message that we've been hearing. It is rather unfortunate, it is a rather unfortunate belief that it seems like there is a belief that the battle against HIV and AIDS can only happen in offices or government buildings, public or private. And if the campaign is not seen there in such buildings, then it means it is not happening. We wish to confirm today that the fight against HIV and AIDS and TB is in our villages, in our communities and townships, and even on the streets of our country. And that is where our focus has been, and as it should be. Many here might have forgotten the real crisis brought about by HIV and AIDS, which was the biggest crisis globally and happened in South Africa, especially around 2010, where death was an everyday occurrence. We were burying people in large numbers every day. There was a big absenteeism from work. Children were being orphaned as their mothers were dying. By that time, maternal mortality driven by this pandemic had reached a staggering 249 per 100,000 live births. I want to repeat, a staggering 249 women were dying per every 100,000 live births. And the number of children who were born HIV positive was high. As a response, we launched the world's biggest HIV counseling, testing, and treatment campaign. We then announced that we're going to test 15 million South Africans in 1 year as part of that massive campaign. I want to remind you that we were never given a chance. Experts from all walks of life, including even the media, never gave us any chance because they thought we were just going to continue along the lines of voluntary counseling and testing, or VCT, as it was called that time, which relied on passive self-reporting, where people will come into health facilities to ask to be tested. Our target of 15 million people was attacked as an unattainable pipe dream. And we were told that the best that we could achieve was to reach 3 million people only after 1 year of hard work. We did not relent. We rather changed the approach from voluntary counseling and testing to what we then called HCT, HIV counseling and testing. Meaning, we go out in the villages, churches, places of work, communities, sport clubs, royal families, to offer South Africans counseling and testing, and to put those who were positive on ARV treatment. And contrary to the naysayers I wish to remind you that we reached 18 million people in a period of 18 months in that program. I also wish to remind you that we had more people who needed ARVs than the money we had. So with the help of the Clinton Health Access Initiative for CHAI and UNAIDS, through negotiations, we decreased the cost of ARVs by a whopping 51%. We then implemented the single tablet or fixed dose combinations of ARVs, which enabled us to extend antiretroviral therapy to many more people without even increasing the budget. The results of these interventions were like this. So as a result of these massive interventions, life expectancy has risen from 54.7 years in 2010 to 66.5 years in 2024. One of the most prominent scientists of our time, a global icon, Professor Salim Karim, said this type of achievement is equivalent to what happened after the abolition of slavery. Those were the impactful words that he said publicly. Maternal mortality ratio pre-COVID, that means around 2019, had reduced dramatically to 86 per 100,000. Remember, around 2010 it was 249 women dying per 100,000. Now it was only 86. Unfortunately, of course, it rose again during COVID to 111, but now has dropped once again to 95 per 100,000 post-COVID. That's the achievement that we made. We also launched prevention of mother-child transmission, which resulted in the number of babies born HIV positive being reduced from 70,000 babies born HIV positive per annum by 2004 to only 1,079 in the financial year 2020, March 2020, which is around 7% of the babies that were born. Now the figure is 643 in the financial year ending March 2025. And please sit down carefully and go back to the period in 2024 when 70,000 babies were born HIV positive, and look at the number of babies who are born HIV positive now, who are now 643. It's around 0.07% from 7%. As a result of the success in combating HIV/AIDS, TB incidence among people who are living with HIV has reduced by 65% between 2007 and 2021. And in the same period, mortality among people living with HIV has reduced at that time by 80%. Now, UNAIDS has calculated that to bring an end to AIDS as a public health threat to our country, we should reach targets of 95, 95, 95, meaning 95% of HIV positive people must know their status, and 95% of those who are positive should be put on ARVs, and 95% of those who are on treatment should achieve viral suppression, whereby they stop transmitting the virus to other people. That was the objective of the 95, 95, 95. We know that there are 7.9 million people in South Africa who are estimated by UNAIDS to be HIV positive. Now, at the moment, in terms of the UNAIDS target, we are at 96, 79, 94. And today we have 5.9 million people who are on antiretroviral therapy. We have reduced death from HIV/AIDS and concomitantly reduced the death from TB. When we started this program, we needed 5.3 billion rand. Today, we are spending a whopping 46.8 billion rand, of which 7.9 billion is from PEPFAR. The money that President Donald Trump has announced that is withdrawing. Now, it is inconceivable that out of 46.8 billion rand spent by the country on HIV/AIDS program, the withdrawal of 7.9 billion by President Trump will immediately lead to a collapse of the entire program. We believe it's inconceivable. Ladies and gentlemen, we must put it categorically clear that under no circumstances will we allow this massive work performed over a period of more than a decade and a half to collapse and go up in smoke because President Trump has decided to do what he has done. If we do so, we'll have thrown massive investment in time, money, and human resources away. And at any rate, we don't want to go back to the period where death was the order of the day. And we want to believe that there is not a single South African who wishes for the country to return to that painful period. Now, what have we done since the pulling out of PEPFAR? Well, we are not here today to stage a school hall debate with those who have preached the collapse of the program. What we are here today is to provide facts and figures and an account of what we have done. And in this case, we are prepared to be fact-checked by the media houses because we are aware that some media houses have established fact-check systems. And we are wondering why this issue is not being fact-checked. We are really wondering because we know those systems are there. Now, what are the facts? Fact number one, PEPFAR was supporting the Department of Health in 27 HIV/AIDS high burden districts out of 52 districts in the country, in 8 provinces. Districts are 7 in KwaZulu-Natal, 5 in Eastern Cape, 4 in Gauteng, 3 in Northwest, 3 in Mpumalanga, 2 in Free State, and 2 in Limpopo, 1 in the Western Cape, which is the Cape Metro, which we know constitutes 60% of the province's population. Fact number 2, in these 27 districts, there are 2,772 public health facilities. Fact number 3, in these 27 districts, there were only 12 specialized clinics that were independent from government and managed by NGOs, which were providing services mainly for key populations and funded by PEPFAR. I want to repeat this fact number 3. In these 27 districts, while there are 2,772 public health facilities, there were only 12 specialized clinics, independent from government, clinics managed by NGOs, providing services mainly for key populations, and they were funded by PEPFAR. Key populations include transgender men having sex with men, sex workers, and people who inject drugs. Fact number 4. In these 27 districts, the total number of people in these key populations who were clients served by these 12 specialized clinics were 63,322, of which 41,996 are found in only one city. That's the city of Johannesburg. Now, ladies and gentlemen, these are not just numbers, but they are known people with names, addresses, and contact details. Fact number 5. When the PEPFAR-funded clinics were closed, we removed the files of these people from those clinics to the nearest public health facilities. And we can confirm today that all 63,322 files belonging to these key populations were moved to public health facilities. Then the work to conduct their owners to transfer them to public health facilities where their files are started in earnest, and it still continue even up to this moment. In the process, some clients who were conducted requested that they be referred to other different facilities which were more accessible and more convenient to them. And we agreed. We were doing so, and we are still doing so. But due to the discreetness and sensitivity of this matter, we are not in a position to identify these particular people who have been moved. Fact number 6. It is not only PEPFAR which was dealing with key population clients, but other prominent funders like Global Fund have been supporting the country with health services for these key populations. 34 designated facilities are funded by the Global Fund for this purpose across Gauteng, Free State, Northwest, Limpopo, Eastern Cape, KwaZulu-Natal, Mpumalanga, and Western Cape. These 34 facilities include community, public, and NGO facilities. And the total number of key populations that were saved by Global Fund in these facilities was 74,140. I've just announced that PEPFAR was servicing 63,000, but Global Fund was servicing 74,000 as of the end of March 2025. And nothing has changed in these facilities. Nothing at all. There's been no change because they are funded by Global Fund. They continue work as they've been doing, and they are still continuing work now, saving these 74,000 people. Fact number 7. In addition, the government itself funds NGOs to continue providing services to key population clients. 4 of these NGOs, the Alliance Against HIV and AIDS, the Center for Positive Care, the National LGBTI Health Campaign, and North Star Alliance, are solely funded to provide services, funded by the state to provide services for key populations only. Fact number 8, the government also continues to provide services to some of these key populations in identified areas which we have called HTAs, or high transmission areas, such as truck stops and areas dominated by commercial sex workers. Between January and March 2025, we had targeted 154,298 key population clients in these areas and managed to reach 133,790. That means we have reached 88.36% of our target between January and March. Fact number 9. As part of the immediate plans to ensure continuity with access to healthcare services by members of key populations while working on a long-term plan, the department, in collaboration with various partner organizations, has embarked on a sensitization training program targeting healthcare workers on the barriers of affecting access to healthcare by key populations. The training is aimed at empowering health workers to appropriately engage and treat key population clients with dignity and the respect they deserve. Fact number 10, I can report today to you that the training we have conducted has reached 1,012 clinicians and 2,377 non-clinicians in 7 provinces. And for obvious reasons, the majority are in Gauteng province. The training is still going on to finalize the last province. I mean, the last 2 provinces rather. The intention is to reach 100% primary health care facilities across the country and have this training fully incorporated into regional training centers as part of our long-term plans. This intervention has shown to be effective in reducing stigma, judgmental and discriminatory attitudes towards marginalized groups, especially the key populations. This essential intervention is in line with the National Strategic Plan of HIV, AIDS, STIs and TB 2023 to 2028. Fact number 11. In these 27 districts, there were 271,606 people who are working on the HIV/AIDS programs every day. 15,539 of these were funded by PEPFAR, of which, yes, we can confirm today, unfortunately, 8,061 are out of their jobs. So out of 271,606 people working there, 15,539 were funded by PEPFAR. And because PEPFAR is off, 8,061 are out of jobs. That's very unfortunate, but we can confirm it. And these are people of interest when we talk to funders and our own treasury. The remaining 7,478 people, that means remaining from 15,000, are still employed because they are funded through Center of Disease Control, or CDC, at least until September. So they are still on the job and doing their work as they were normally doing. So it means, ladies and gentlemen, we still have a workforce of 263,354 healthcare workers working on HIV/AIDS program in this previously PEPFAR-funded districts. We still have that workforce, 263,554. Fact number 12. The 8 provinces in which PEPFAR was active have established roving teams specifically for patient monitoring and data capturing to ensure that our data is up to date. Gauteng has already appointed and trained 75 data capturers since the pullout of PEPFAR, while Northwest and Mpumalanga have appointed and approved 173 and 200 data capturers respectively. This will greatly improve data capturing by facilities and provinces accordingly. And as soon as details of the other provinces become available, we'll give them out. Now, Close the Gap campaign. We have informed you earlier that in terms of UN/AIDS targets, we are at 96, 79, 95. Excuse me, 96, 79, 94. And we have calculated that to move the 79, the middle 79 to 95, we need 1.1 million people who are known to be HIV positive but are not on ARVs. We call this campaign Close the Gap campaign. That means closing the gap on the 95, 95, 95. Now, one of the most respected media houses stated in a report last week that the Minister of Health launched a campaign without any plan and without any budget whatsoever. This was very painful to read, having the facts here at our disposal. So this brings us to fact number 13. On the 3rd of October 2024, we held a meeting to plan for this campaign with our partners inside the country and internationally. They all came to South Africa to plan this campaign, which a prominent newspaper said the minister launched without any plan. This meeting was attended by the former PEPFAR ambassador, Dr. John Kenkasong, and even the American ambassador at that time, Dr. Ruben Bridget too, and the team from the American State Department, the Bureau of Global Health and Security. It was attended by the National Department of Health, with myself as the minister leading the delegation. It was attended by South African National AIDS Council, with the CEO leading the delegation. It was attended by the Bill and Melinda Gates Foundation. It was attended by UNAIDS. It was attended by the World Health Organization. It was attended by the Global Fund, the Peace Corps, district implementing partners, the VETS, RHI, the American CDC, etc. They were all in that meeting planning. And so if they report that the minister launched a campaign without the plot, without the plan, if it was meant to denigrate the minister, you must know that it has denigrated all these people, because they must be surprised what happened to the plan, in which they said for the whole day to put together. So these teams of people sat down to develop the plan together, which the minister campaign, which the minister is supposed to have launched without a plan. Fact number 14. After this meeting I've just mentioned, SANAC extended plenary was convened on the 22nd of March 2025. The planning meeting was on the 3rd of October, and on the 22nd of March, SANAC called an extended plenary in order for members to receive and endorse the plan or reject it. All the stakeholders. We wish to remind you that the coordination of the war against HIV/AIDS in South Africa is through SANAC. For those who might have forgotten, SANAC consists of 18 sectors of civil society, including people living with HIV and AIDS, all government departments, including premiers of the provinces, the private sector, the development partners, the researchers, and academics. And they were all duly represented in this extended meeting. The meeting received the report about this plan, and they all endorsed it. I don't remember in that meeting on the 22nd, anybody raising their hands and seeing something wrong with this plan, which was put together on the 3rd of October. The plan to look for this 1.1 million people was hence adopted with details, starting with numbers per province, numbers per district, even numbers for each and every health facility, public health facility in the country. Fact number 14. Contrary to what is being reported, while the plan was to reach 1.1 million people by the end of December 2025, I can report to you now, as I'm standing here in front of you, that we've been able to reach 520,700 people living with HIV and AIDS and initiated them on treatment. And this includes women, men, and children. And as you can see, this is more than 50% of the target that we have set for ourselves to reach. We had planned that by now we'll have reached 100,000 people, but we reached 520,000. This work has been made possible by the budget reprioritized of an amount of 659 million from HIV/AIDS conditional grants. Now, the prominent newspaper I've spoken about did not only say the minister launched a plan without a plan. Launched the program without the plan. But they also said without the budget. And I'm here to report to you that 659 million rand from conditional grants was put together for this plan. So it had a budget. The reason that we're able to reach 500,000 people within a very short space of time was because of a weekly check-in meetings with the provinces. Ever since PEPFAR made this announcement, there are weekly meetings in the department provinces where reports that come from the ground are verified in the presence of provincial colleagues before they are regarded as final figures for reporting. It is for this reason that we are even able to aggregate the numbers of newly diagnosed or initiated against those who are returning to care. Based on this, we are confident that we will reach the 1.1 million by the end of the year. We must commend the role players, especially civil society, because they helped in this massive mobilization, which have been taking place since March. Without them, we will not have come anywhere near the figures we have reached. Fact number 15. As part of this response, the team from National Department of Health and SANAC have started a program of provincial roadshows through which we engage provincial structures at close range, including provincial and district AIDS councils, traditional leaders, and civil society in those areas. Targets were set for all 9 provinces, for districts and facilities. And so they were able to trace the targets even up to facility level. Fact number 16, we have a stable supply of ARVs because, as we said before, we procure 90% of our ARVs from our own government fiscus. And this is supported by 10% from Global Fund. And the Global Fund, as we said before, after the aftermath of the pullout of PEPFAR, pledged 1 billion rand for more ARVs to be procured. And the orders have already been signed off. Fact number 17. While a lot has been said that the government was absent, the reports mention specifically that the minister and the president had gone into hiding. While this was being reported, I want to outline a sequence of meetings with prospective donors and funders, and a sequence of other events in the aftermath. On the 29th of January, a few days after the trans announcement, I presented the contingency plan before an extended cabinet of the country. Extended cabinet means where you are bringing in premiers, deputy ministers, and SALGA. On the 5th of February, weekly provincial review meetings with provincial and partners commenced on monitoring impact of the US decision, their impact on the health services. On the 10th of February, I personally engaged with potential funders and private sector to solicit support to close the PEPFAR funding gap. On the 11th of February, the Director General issued a circular on provision of uninterrupted HIV prevention, treatment, STI and TB services across all public health facilities. On that very same day, the 11th of February, I had met with the Minister of Finance and his team in Cape Town to discuss what should be done. On the 19th of February, I briefed the Portfolio Committee on Health on the impact of the United States government decision on the plans to address the funding gap. On the 23rd of February, I met with His Excellency President Bill Clinton, who had visited South Africa, who wanted to hear what type of support are we looking for. And on the 25th of February, I met with the Chief Executive Officer, rather not physically, it was a telephonic conference with the Chief Executive Officer of Bill and Melinda Gates Foundation to solicit support to close the funding gap. On the same 25th of February, we launched this campaign with all MECs, with SANAC sector, with civil society, with key stakeholders. We launched this campaign to look for 1.1 million people. And it will have been painful for so many people belonging to such prominent stakeholders to come and agree to launch a campaign which had no plan and no budget at all. On the 3rd of March, I addressed a PEPFAR implementing partners and United States government representative on this executive order. Excuse me, sorry, correction. On the 3rd of March 2025, I addressed PEPFAR implementing partners on the United States government executive orders and our plans for moving the campaign, HIV/AIDS campaign forward. On the 6th of March, I led a debate in government on the effects of United States government executive orders and assured them on progress made to ensure uninterrupted service delivery. On the 14th of March, I met with the French Development Agency to solicit their support to close the funding gap. On the 24th of March, the NTB campaign was launched to finding TB missing clients and conduct 5 million TB screening tests. Between the 8th of April and the 23rd of May, which is still coming, we had started these provincial roadshows on closing the gap. As I said, the roadshow started on the 8th. They are due to end on the 23rd of May. And the roadshows are addressing healthcare workers, AIDS councils, civil society, private sector and other government departments, supported by the Center for Disease Control and Prevention. In conclusion, ladies and gentlemen, we must accept that President Donald Trump has taken away what belongs to his country. We must accept that this has left many people distraught, distressed, and even perhaps fearful. And we also accept that people react to stress in different ways. Some people cope with stress by creating enemies which should not be existing. And sometimes this gives them the comfort and the security they desire under such difficult conditions. But I would also like to believe that every single South African from all walks of life has a wish and a desire to end the scourge of HIV and AIDS as a public health threat, at least by 2030. But fighting each other, denigrating each other, pointing fingers, reporting and spreading disinformation about the status of the campaign is definitely not a way in the aftermath of the President Trump's decision. It is certainly not a way to end the scourge of HIV and AIDS. Rather, this is a time to come together, unite, and fight as one strong unit. As government, our doors are open. And as a country, we have got all the coordinating structures, which is the South African National AIDS Council, the highest coordinator of the whole campaign. No single South African can legitimately claim that SANAC doesn't represent them and give them a chance to participate and convey their views, their beliefs, their desires, and their fears. SANAC is the place to confront each other and hold each other accountable, and we should not be doing so anywhere else. But I also want to state clearly that propagating wrong information about the status of the HIV/AIDS campaign in South Africa in the manner that is being done is no different from the approach adopted by AfriForum and its ilk, which led Trump to thrash the whole country. If people believe that the course of action they must take to mobilize funding to replace what Trump has done is to adopt the AfriForum approach, it is actually going to achieve the opposite. I'm saying so, ladies and gentlemen, because I've already received numerous phone calls from the funders that we've met with, who are asking us, why should they continue to plan to pay more money in a program that is said to be collapsing? And they're asking, is their money going to collapse together with this program in South Africa? Because it's said to be collapsing. So I would like to emphasize once more that we are not enemies of each other, but the scourge of HIV, AIDS, and TB should be looked upon as our common enemy, which we must unite to fight together, rather than it dividing us. I thank you.
Thank you, Honorable Minister, for a comprehensive report and update as far as the country is doing to mitigate the impact of funding gap created by U.S. government on the HIV, AIDS, and TB program in the country. So on that note, I'm going to take questions from the floor. And I believe we should be having questions through our virtual platforms. Colleagues who are responsible for questions on the virtual platforms, just get them ready while we are taking questions from the floor. So I'm going to take questions. As you know, the rule of the game, you introduce yourself, the media house you come from, then you pose the question. So let's hear. Number one, number two. So far, we've got two hands in the house. We believe we'll get more hands maybe as we get the follow-up questions, but also through our visual platform. So on that note, I'm going to get the first media colleague to raise the question. Go on.
Hello, Minister. This is Nellie Payton from Reuters.
Sorry?
Nellie Payton from Reuters.
From?
Reuters.
Oh, Reuters. Yes. Yes. Thank you.
Thank you. You've given a number of figures which suggest that things are going okay. There are also other figures which are quite concerning. We reported yesterday that viral load testing has dropped across the country. It's down around 20% for pregnant women and infants. And these are figures that come from the NHLS and have also been analyzed by the NICD. So I presume that that's information that you would have access to. Are you not concerned by this drop in testing? And then additionally, you have said that South Africa has lost some 8,000 health workers that were funded by PEPFAR. People are saying that clinics are understaffed, that people are not transferring to government clinics. And so in the face of all this evidence, are you really thinking that everything is still fine?
You got the question, Minister?
Yeah.
Okay. Thank you very much, Nelly. Second question, can you switch off your mic so that we can hear the voice of our colleague? Over to you.
Trudy Jones from ENCA. You say that in 27 districts there were over 2,000 people.
Sorry.
Just raise your voice, colleague.
ENCA.
Trudy Jones, Minister, ENCA. The 8,061 people who are out of their jobs, what's the plan for them? That's number one. Number two, Budget 3.0 is coming. The minister will deliver this fiscal framework next week. Are you confident of a bigger budget to look into some of the issues in the state of health in this country? Number three, President Cyril Ramaphosa will be embarking on a working visit to the United States next week, 19 to 22, those are the dates confirmed. Are you optimistic of this visit? Perhaps maybe talks around PEPFAR and what can be done to resuscitate this entire program? Thank you.
Thank you very much. For now, we'll allow Minister to respond to these questions while we are getting ready for the virtual questions.
Yes. The first question from the lady from Reuters. I want to state it very clear that I've never said everything is fine. At no stage have I ever said so. And please correct that. I never said everything is fine. All I said is that it's wrong to say the campaign of HIV/AIDS program in South Africa is collapsing, because it's not. The fact that we've put up these plans, the fact that we are running road shows, the fact that we've put up so many people on the road, and the fact that we are having weekly, not monthly, weekly meetings, which we're not having before the PEPFAR announcement, shows that we know that something can go wrong. So if viral load testing has dropped, does it mean the collapse of the campaign by any stretch of imagination? No. We expected that some of these problems will occur, but we are sitting with them every day. But simply because a problem is occurring, to go and announce that no, the HIV/AIDS program has collapsed, is wrong. And I will remain believing that it's wrong. But that doesn't mean that, because why should people sort of celebrate the collapse of such an important program instead of encouraging that we move with each other? Why should something that goes wrong, done because of what Trump has done, be sort of celebrated? To what end? But we have never claimed that there are no problems. They are there. That's why in my statement here, I said we are all distraught, we are distressed, but it looks like we are reacting to stress in different ways. Pule, you said, what is the plan for the 8,000 people that have lost their jobs? I wish we had any plan. At the present moment, all we can do is to present our plans to funders. And I've given you a long list of funders we have met. There's not a single one who said, no, we won't help. But up to today, there's not a single one who came to the party. Either private funders or governments around the world. There's not a single one. At the moment, the only one who came to the party, the Global Fund, came to the party with 1 billion rand only for ARVs and nothing else. So I'm not going to stand here in front of you and claim that we have got any plan for the 8,000 people beyond just speaking to funders and our own treasury, which still have not yet responses on what's going to happen. The second question, Puli, is about the budget. Whether I'm optimistic that we'll get more money. I don't really want to answer that question before the budget is read on the 21st. The only bad news is that I'll be in Geneva attending the World Health Assembly. So I won't be there at the budget reading, but I'll hear about it, Pule. Then I'll respond to you thereafter, I promise. If I was going to be in Cape Town, I was going to come to you to offer myself to be interviewed by you immediately after the budget has been read. But I can't preempt anything whatsoever because the budget has not been read. And I happen to know that things change almost every day until the last minute. And yesterday, the Minister of Finance briefed the cabinet, and of course I can't disclose what was discussed in the cabinet meeting, but he did brief us about what is likely to happen, not what will happen, what is likely, because every day figures change and numbers are moved around. You asked me about whether I'm optimistic about a visit by the president. I'm an eternal optimist by nature, but I think it's difficult for anybody to predict Trump. I'm sure you are aware of that. Because you can be optimistic and he does something different, or you can be optimistic and he says something else. And basically people don't know about what you'll say or what you'll do. But the good thing is that our president is going. Let's see what he come out with. I'm not in a position to declare optimism or pessimism because of the manner in which Donald Trump worked. Because what if I'm optimistic? Immediately when we leave here, he tweets, you know. And then what will I say, you know? Thank you very much.
Thank you very much, Honorable Minister, for your responses. Let's get the questions from our social media platforms. You want to? Oh, maybe let me give you a chance to. We'll add your question on top of the questions from social media platforms.
Thank you. Thank you, Minister, for that response. I just have one more question about the 520,700 new initiations. I've spoken with a few people in the sector who said they did not see evidence that there were new initiations.
All right, so those are live visuals we're beaming to you from Pretoria, where the health minister is holding a briefing in response to the reports around South Africa's HIV and AIDS program in the wake of the US cutting aid to the country. And I suppose it's important to emphasize that this was a decision that affected a number of countries around the world. So it wasn't Donald Trump really responding specifically to South Africa, but we know there's a whole lot of context around the very, let's call it, tenuous relationship that now exists between South Africa and the United States. The thrust really of what the minister has had to say is that the HIV and AIDS program is not falling apart, and he's really pushed back strongly, listing a number of what he calls facts. I think it's about 14 or 15 of them, in response to assertions that the cut in PEPFAR, that's the presidential funding aid from the US, which was meant to bolster South Africa's fight against HIV and AIDS, has not resulted in the collapse of the program in its entirety. In fact, he's spoken about how out of the 271,000 people who work in the space, only 8,000 jobs have been lost. And I say only, but I suppose in context, you know what I mean. And he's saying really that those job losses cannot really result in the collapse of the entire program. We know that there's also been a campaign to reach about 1.1 million people by the end of December this year. The minister pointing out that 520,000 of them have already been reached. He says that the country still has a stable supply of ARVs for the thousands of people who, of course, rely on this life-saving treatment. He says we must accept that Donald Trump has taken away what belongs to his country. And in fact, what South Africa has to do now is to try and respond in the best way they can. The minister there also saying that he's not saying everything is hunky-dory. And I think it was important for him to emphasize that, because many people, I suppose, would have interpreted this media briefing as trying to paint that picture. There are still challenges. In fact, Aaron Motsoaledi saying that funders are jittery because of reports that the program itself is collapsing. We'll continue listening into any of the other questions that are being posed. But as you can see on your screen, a number of other stories we're watching for you. Sentencing proceedings in Gqeberha are underway for a Gauteng businesswoman, Andy Gawa, who was raped, we understand, in that province. In fact, one person has been arrested insofar as that is concerned, and these are sentencing proceedings underway after DNA linked that individual to the crime scene. And then, of course, the Free State asbestos corruption trial underway in the Free State. Ace Makashule's lawyer is the man on the screen there, currently cross-examining the state witness. More